Welcome everyone to today's session. Thank you for joining us today. We'll get started in just a few moments, but in the meantime, please write in the chat box who you are and where you are joining us from. And please also make sure that you select your language. Everyone needs to select a language, whether you're listening in English or French, to ensure that you're able to listen to all of our speakers today. And to select a language, please click on the bottom where you see the globe icon, and it will take you to the English or French channel. You can then mute the original audio. Again, please select your language, whether you're listening in English or French. And we've also shared a few poll questions that we encourage you to respond to while we wait for others to join. If you'd like to read these questions in French, the French translation will be added to the chat box. The questions are also on the slide in both English and French. And as you'll note, the answer choices are in both English and French in the poll. If you're just joining us today, welcome. We'll get started in just a few moments. But in the meantime, please write in the chat box who you are and where you're joining us from. And please also make sure that you select your language. Everyone needs to select a language, whether you're listening in English or French, to ensure that you're able to listen to all of our speakers today. To select a language, please click on the bottom where you see the globe icon, and it will take you to the English or French channel. You can then mute the original audio. Again, please select your language, whether you are listening in English or French. And we've also shared a few poll questions that we encourage you to respond to while we wait for others to join. And if you'd like to read these questions in French, the French translation of the poll questions has been added to the chat box. And you'll also see that they are in both English and French on the slide as well. You'll note in the poll that the answer choices are in both English and French. All right, we're going to go ahead and get started today. Thank you again for joining today, and I want to welcome you again to today's session. My name is Brittany Getch. I'm a program officer on the Knowledge Success Project at Johns Hopkins Center for Communication Programs. Knowledge Success is excited to be partnering with FP 2020 on this webinar series. This is our 8th session in the Connecting Conversations series. And if you missed the sessions in the first module or any of the previous sessions in this module, you can watch the webinar recordings and get up to speed. Those are posted on the FP 2020 YouTube site, and we're also publishing blog posts on the Knowledge Success site where you can find those links and read summaries from the previous conversations. This webinar will last for approximately an hour, and we'll have an open Q&A discussion with our 3 speakers. This webinar is being simultaneously interpreted into French, as I mentioned, and it's being recorded in both English and French. The webinar recording will be available in the coming days. And as a reminder to please select your language, whether you're listening in English or French, to be able to listen to all of our speakers today. Participants are muted throughout the duration of the session, but if you have questions for our speakers, please type them in the chat box as you follow along. My Knowledge Success and FP 2020 colleagues will be moderating the chat box, and we'll get to as many questions as time allows. Just a little bit about this Connecting Conversations series in case you're joining us for the first time. Connecting Conversations is a series of discussions on adolescent and youth reproductive health, hosted by FP 2020 and Knowledge Success. Through the middle of next year, we'll be co-hosting these sessions every few weeks on a variety of topics. This is not your traditional webinar series. We're using a more conversational style. We're encouraging open dialogue and allowing plenty of time for questions to guarantee that you'll be coming back for more. And the series has been divided into 5 modules. Our first one, which focused on a foundational understanding of adolescent development and health, started on July 15th and concluded on September 9th. Our second module is focusing on parents, preachers, partners, and phones, engaging critical influencers to improve young people's reproductive health. And first, I'm pleased to introduce our moderator for today's session on partners, Kate Lane. Kate Lane is the Director for Adolescents and Youth at FP 2020, where she works closely with FP 2020 countries and youth focal points on country commitments to adolescents and strengthening the Secretariat's capacity for meaningful youth engagement. She has over 30 years of experience in adolescent and youth reproductive health. So Kate, over to you.
Thanks, Brittany, and good day to everybody. As Brittany mentioned, this module is focusing on parents, preachers, partners, and the next session that we'll do in a couple of weeks is around phones. And these are factors that are very influential in the decision-making of young people around their decision to use contraception. So we have three really good speakers this morning who are going to talk about their experience in working with the partners of adolescents. Our first speaker is, hang on just a second. Our first speaker is Anjali Coley, who's an associate professor at the Institute for Reproductive Health of Georgetown University. And Dr. Coley has over a decade of international health and development experience, which focuses on research and practice for the prevention of gender-based violence, violence against children, HIV/AIDS, and promoting improved mental health and resilience. She's a senior research officer and provides strategic leadership, research expertise, and technical vision under the USAID-funded Passages Project. Our next speaker comes to us from Niger. Akim Asani Oseni is the Reaching Married Adolescents and Community-Based Services Technical Manager based in Niamey with Pathfinder International. Asani is the RMA and Community-Based Services Technical Manager. He's an epidemiologist, a biostatistician, and an expert in intervention epidemiology. He's got over 5 years of implementation experience with adolescents and youth reproductive health projects. And Akim will be speaking in French today. And then finally, we have Shamsi Kazambaya, who is a senior program officer with Promundo in the US. And Shamsi is a senior program officer. She coordinates technical assistance to the Young Men's Clubs Against Violence project in Kinshasa, DRC, with the Living Peace Institute. And she also leads Promundo US's technical assistance to projects in East and Central Africa. Shamsi has more than 10 years of extensive experience in coordinating the implementation of policies and programs that focus on the promotion of gender equality, women's rights, and gender integration in reproductive, maternal, and child health. Prior to working with Promundo, Shamsi worked with the Society for Women and AIDS in Africa in Rwanda as the executive secretary for the Rwandan chapter, coordinating projects that provide care and support to people affected by HIV and AIDS with the Rwanda Men's Resource Center, where she also coordinated Men Care Plus for 3 years, engaging men as equitable, nonviolent partners and caregivers in maternal, newborn, and child health, and in sexual and reproductive health. And lastly, with JPIGO, which is an affiliate of Johns Hopkins University, in the position of gender advisor for the Maternal Child Survivor Project. Shamsi has a master's degree in gender and development. So 3 great speakers today that we're really, really lucky to have with us. Before we go to our conversation, I was just going to revisit the poll. So if we can have those poll results up. They were pretty softball questions. So I hope you got most of them right. The most commonly reported perpetrators of sexual violence against girls in many countries are teachers. Actually, that's false. So 70% of you got that right. It's often people that are known to them, people in their community. The male partners of young women have little or no influence over their contraceptive decision-making. And 90% of you said that's false. That's the correct answer because young male partners definitely have a say over whether young women use contraception. And young women are most at risk of negative health outcomes when their partner is substantially older, and that is also true, especially when young people have partners who are 5 years older, 5+ years older than them. They are much more at risk for poor outcomes because they simply don't have the capacity to negotiate equitably with an older partner. So thanks to all of you that got those questions right, and those of you that got them wrong, I hope you learned something today. Okay, so now we are going to go to some questions. So let me pull up our discussion questions to start the conversation. So I'm going to go ahead and start. I'm going to throw this out to all 3 of you, and whoever wants to start by answering, please just feel free to take a stab at it. So the first question I'm going to pose to you is, we often find it challenging to reach the partners of young women because young women may be using contraception covertly or because young men don't feel comfortable in clinical settings. So what have been some of the ways that you have successfully reached out to the partners of adolescents? So I'm going to throw that out to all 3 of you, and which one of you would like to start first? Anjali, you look like you'd like to start.
Sure, I couldn't tell if Shamsi was about to speak.
And then Shamsi can speak.
I'd be happy to start. So our project, I work on the Real Fathers Project, which really focuses on young men at these critical stages in their life where they're about to become fathers, or like they're new fathers, or they're newly married, and looking at them as this opportunistic stage where we can start to engage them. So our project has reached young men through working with community leaders, trying to identify who might fit this age group, whose partners might also be interested in them engaging in a mentoring session, and then engaging women and men to explain what the program is. And the program is a mentorship program, so trying to bring men into one-on-one and group engagement to start to really unpack what their relationship dynamics are, how they're communicating together, and then creating opportunities for people to apply new skills in their relationship. So for us, I think one of the key components has been this community-based mentorship model of engaging men. I'm happy to say more, but I'll stop for a minute.
Go ahead, Shamsi.
Transformative approach, whereby we bring together partners, male partners in small groups in gender transformative group education to actually make them start reflecting, questioning, and challenging harmful gender norms. And, starting coming up with some new attitude and behaviors, especially around those issues, around access, decision, for instance, using contraceptives and all that, because we believe that when we talk about accessing or using contraceptives, there is a lot doing with gender relations, but also, when we're talking about gender dynamics, we talk also about power relations. And most of the time, when we talk about power relations, we all know, basically in the region where I work, I've been implementing most of the project at Promundo, is in Africa. So most of the time in Africa, the decision being, on using contraceptive, on almost all the decisions are taken by the man. So that's why actually the approach of Promundo is to bring men, to bring boys on board, to engage them positively so that they can start reflecting on the negative side of not being part and partial and partners, real partners and allies when it comes, to health of their partners, of their daughters, of their, families. But you're also having the approach, we have been adapting a program called Program H that again brings in young men, expectant fathers. We're having in Niger, I think my colleague is going to share Akim, where we are working with what we call the École de Mari, husband school and future husband school, whereby again we bring young men together to start reflecting just and challenging those negative and harmful norms so that they were prepared when they become fathers or partners to make sure, there is this open discussion with their future female partners and also starting adopting new positive attitudes and norms. We have also tried to create this, I could say, new model at Promundo, which is a kind of, intergenerational model, whereby we try to bring together parent, especially parent of adolescent children, to start creating this safe space for those adolescents to openly discuss those sensitive, topics, because again, I'm talking about basically about Africa, whereby those topics are still taboo, very sensitive. And again, we know that parents play a very big role when it comes to deciding, to accessing, to using, contraceptives. So we try to create this environment whereby we start, bringing parents and the adolescent children to discuss and, to help them to take this decision and coming, more open to access the services. So maybe I'm going to share more, but not only parents, we also create this environment with also healthcare providers. It has been also another challenge, whereby in our gender transformative group education, even when partners or young men understand the needs, the necessity and the benefit to be engaged, but when they get to go to seek for services, the barrier becomes who might be an aunt, a neighbor, a friend of the mother. So it creates a kind of stigma, which doesn't allow those young people to access services. So at Promundo, I've created again this, gender transformative training for the health providers, so that the space becomes, friendly to those adolescent people. And the other group I've been working with and we developed manuals to work with is the religious and traditional leaders, especially in West Africa. So how much they are very influential. So we are creating also these kind of groups to make sure that, when they are talking to the communities, when they're talking to that young people, they're also bringing this, discussion, trying to make it more, I would say less taboo, So this is briefly what I can share for now on the way we approach these topics and how we engage the partners and the boys and men, to help girls and women to access services and also to open up about the discussion. Thank you.
Yeah, you mentioned a couple of things that were quite interesting to me that we can talk a little bit more as we go on about what gender transformative means. But, and I think that was something that the Real Fathers Project really tried to work on, was gender transformation. And this is something we're talking much more about these days in this field of adolescent reproductive health, is we have to tackle these serious gender norms which affect girls, but also affect young men. So it's really, really important that we're building this enabling environment, which obviously creating situations between couples where they're able to converse about these things, but also in a supportive environment in the community, on the part of providers, on the part of religious leaders, on the part of parents, so that everybody is sort of providing the same message to young women and young men about the importance of and the value of using contraception. So I'd like to turn to Akeem to talk a little bit about the work that he's supporting in Niger with these Écoles de Marie and how you're seeing sort of this gender transformation in the partners of these young women. So Akeem, over to you. And there you go.
Ok, merci beaucoup.
Thank you very much. I hope that you can hear me. In Niger, we have implemented many interventions. We are mainly targeting male partners, and we are doing this within the framework of different interventions. The first was part of a development project that was trying to train and teach young people. We talked to them about the process of their first pregnancy and how to reduce their risks during this first pregnancy. And we also taught them about family planning services. We noticed that married adolescents often found themselves in a circle with many different influences. An adolescent who had a partner that she did not know, and this does happen in the region where I work, adolescents are often subject to arranged marriages, and they are not therefore able to evolve within the system. So adolescents often found themselves in a relationship where the woman did not have the ability to kind of develop her own life skills. So we started to reach out to people who influenced the husbands of these adolescents. And we implemented some interventions to provide education for young fathers. We identified people who had a bit of life experience and people who played important roles in the community and who were people who were able to advise husbands of these young people. And we tried to make them aware of the issues and the ways that their partner could benefit from family planning services. Also, in Niger, we're in a country that is over 90% Muslim. And that means that religion plays a very important role in every intervention, and particularly health interventions. So when we're looking at issues of reproductive health, religious leaders have a significant influence. So what we did within our intervention was we tried to transform the influence that these religious leaders had. We wanted them to have a positive influence and to change ideas within the community. So we looked at writings in the Quran and other sacred texts, and we used them to inspire different activities. So we use them to inspire conversations that would promote family planning and reproductive health. We wanted to make the members of the community aware of these issues, and we wanted these people to be able to support interventions that would help change some of these social norms. This was a key change that we made, and this has allowed us to very make some very positive changes to social norms. And it was important to do this so that we were able to reach out to married adolescents and their husbands. In this framework, we have a story about an adolescent who was 15. She married a young man, and they didn't know each other. In fact, they hadn't even established communication between themselves before they started to live together. This couple was exposed to our interventions. And after a bit of time, the person who, once they were married, they were able to sit down and have a conversation. She was able to do this with her husband. And she felt supported by her husband, who had continued to participate in these interventions and who had actually gone out to help her find these services. So this was something they had not even been able to have a conversation together at the beginning of the project. So this was very important. Imagine a woman who is unable to speak to her husband at all, and then she has to discuss these very sensitive issues. So we were able to use this intervention to raise awareness of the young woman and also her husband, so that they were able to work together to plan their family's future and for the future of their children. And it was important she had these conversations with her husband. And that's something that's very interesting. It is these kind of discussions and exchanges that mean that we do need to involve religious leaders. These kinds of interventions have allowed us to work throughout our intervention zones. When we get these leaders involved, we noticed that before we started this intervention, 5 out of 6 marriages did not make it to a 1-year anniversary. Very soon after the marriage, the partners separated. But with the beginning of this intervention and all of the activities that we carried out to help change men's minds and to raise awareness among men in the community leaders noticed that they were more often called upon to come and work through marital issues. And they noticed that couples were much more united and men were much more involved, and many more marriages lasted beyond that 1-year mark. So these are successes that have been pretty impressive. And this is what makes us aware that we need to change these gender norms and change men's mind during these interventions.
Thanks.
Oh, go ahead.
In fact, I wanted to come back to you, Anjali, because some of the things that Shamsi and Akeem have been talking about, I know are so relevant to the work of Real Fathers. And full disclosure, I had an opportunity to visit the Real Fathers Project a few years ago when I was working with USAID. Was completely fascinated by this whole mentoring approach. And so some of the things that Akeem mentioned about this communication, as well as some of the things that Shamsi talked about, gender transformative, I think were some of the things that you were doing in Uganda. So if you could talk a little bit more about how you approach this through the mentoring program, I think that'd be great. Thanks.
Yeah, I'd be happy to. And I also am hearing like very similar echoes from this exchange. So it's really exciting. The Real Fathers approach was it was a product that was developed out of this identified need, both around family planning, but also the use of violence in households. And we were challenged to say, like, how do we start to engage young men in ways that are acceptable culturally and that meet this local need without reinforcing violence or harmful ways of communication? And the project did that by recognizing that we started the project in Uganda, recognizing that there are these elder men that traditionally mentor young men. And that, the project, I mean, I'm talking about it, but it was really developed in partnership with Save the Children and with community members and through some research. And we realized that young men are traditionally mentored by these elder men in the community. So if we could work with elder men in the community and train them to be mentors who were able to work with young men in individual and group settings, that this might create an opportunity for dialogue that had kind of been lost over time due to conflict and economic changes. So that was one piece. We had a gender transformative training and a mentorship training with these elder men, and the elder men were identified by the young fathers participating in the program. And then to be sure that we were selecting elder men that were respectable and that the wives felt comfortable with, the wives also validated that selection. But another key piece that I'm also hearing and what other people are saying is this component of communication. And we made a conscious choice not to directly say like violence is bad or you have to talk about family planning. Instead, the project went through this emotion-based messaging, which was reinforced in part through these mentorship sessions and then in part through a poster campaign which really complemented the mentorship sessions, and then the entire project closed out with a community celebration. So the sessions created space for men to start exploring their emotions, start to build new skills, and learn how to communicate. And what we've seen through our research is that the first thing men say that changed for them, and their wives have supported this, is that their hearts and minds opened, and they started to realize that they could have a very different relationship in their family and with their wives. And there were things that they never thought they could talk about, whether it's decision making around finances, going to, how many children do they want to have, and do they really want to have as many children as the community is encouraging them to have, or does having a smaller family work for them? And how what does their wife think and feel about? And that opened up space then to start engaging with family planning. So our family planning based mentorship sessions come later in the project, but it allowed couples, both men and women, to start exploring these conversations in ways that they had never done before. And then I think because of the elder mentorship part, they were able to find that within both their peers and within elders, there was space for them to shift their behavior against these norms of having large families and start to say, maybe we want a smaller size family because we can actually have more quality time together and spend our finances different and plan differently. But that support structure allowed for that as well. So.
Thank you. Also encouraging folks to drop questions into the chat box, because we don't want this to be just about a conversation between the four of us, but if you have questions that you want to ask. I know there was one question, I think, from one of our participants in Nigeria about Dr. Shamsi, where Dr. Shamsi's working, and I believe, Shamsi, you're in Rwanda?
Yes, I'm based in Rwanda, yes.
Yeah, okay, so the work that you're doing is particularly right now is in Rwanda.
No. Actually, we're having now a big project that we are supporting in West Africa.
Oh, okay.
And this, and this is the one called the Sahel Women's Empowerment and Demographic Dividend.
Right, the SWED project.
So this is coordinated by UNFPA and funded by the World Bank. And we've been supporting, providing technical assistance in this GTA approach since 2018. And we've been covering 6 countries in the beginning, and those were basically Niger, Burkina Faso, Mali, Cote d'Ivoire, Mauritania, Chad. So starting next year, we'll be adding Benin, Cameroon, and Guinea-Conakry. So apart from those countries, we are also, yes, so we are also having similar kind of project that we have adapted in Rwanda for many years, and in DRC, basically in the east, and also in Kinshasa, in the capital city of DRC. But maybe to respond to Adeola's question, we have also implemented the same approach with Plan Canada in Nigeria, in Ghana, and also in Senegal. Mm-hmm. But this has phased out. But actually for now, we are in the phase of scaling up the approach. Because for Promundo, we build capacity, but then we just trying to accompany, local partners to scale the program once we realize that works well in terms of changing mindsets and shifting those norms. and probably we'll get them. But I can also share resources, because for Rwanda, we conducted in RCT once we finished the program 3 years later. And we are in the process of starting now a 7 years follow-up to the RCT results that have been really very impressive in terms of seeing how men and boys are getting more and more engaged, especially on the questions around SRH, using contraceptive. I was very happy to hear what Anjali was sharing. It's basically the same approach we're using with the gender transformative group education, whereby we hear now men and boys, very proudly sharing how they have changed their mind, how they can easily get involved in all the decisions and the household chores and all that. So I think people can just visit our website, but I can also share some resources that I guess will be helpful for colleagues to read for those who are interested. Thank
Yes,
you.
and we will be sharing. We will draft a blog after this session and share out a lot of resources with participants who attended today and others. But you know what, we talk about, there's a couple of terms that you all have brought up that I'd love for you to talk a little bit more about, because I think one of the things I like to do in these conversations is to get a little bit past some of the jargon. So we sometimes toss these phrases around, like everybody understands, gender transformative, social norms. And so I'd love for you to talk a little bit more about what gender transformative has meant to you and how this has helped to shift some of these really pervasive social norms, and even talking a little bit about some of the specific social norms that you've really tried to tackle. Obviously there's things like gender inequities, but then there's other social norms I think that we don't often tease out enough in some of our programs that are highly influential in young women's decisions about contraception. And we'll also have a comment here from one of my colleagues about, and what does women's empowerment mean in the communities where you're working? I think it may have a slightly different understanding in a Niger or a Rwanda or a DRC than it might have in the United States, for example. So I'm going to throw those out to the three of you, and interested to hear what you have to say. So Anjali, you want to start?
Sure, happy to. I'll start with the social norms pieces. So I think, Real Fathers it's addressing multiple norms. I think some of these are around communication. So what can couples discuss, or what should they be discussing, and what are these expectations of who should make decisions and how they should make decisions in the household. So trying to reframe some of those norms around that. And then there's also the norms around family planning and who gets the final decision in family planning and whether that's even talked about. One thing that's been interesting is, I think even, this wasn't necessarily the intention, but people are talking about how they're able to talk about sex differently in their relationships and have enjoyable sexual relationships just because they understand each other better. And I think that gets to some of these communication pieces that deepen the relationship. And there's also norms around violence, but since we're focused on family planning, I won't get into that. So the project was engaged with that in multiple ways. One was through role modeling. So how do we change norms? We want to have people who are demonstrating behaviors that we're seeking to change, right? And so that was the elder mentors, and then over time, these young fathers who changed their behavior. There was also a complementary poster campaign, which was both visual and message based, and that was developed with community members with this idea of like what phrases would resonate to show people this is what a good father is, or this is what a healthy family looks like. And those were always displayed complementary to the mentorship program and in a very public places to reinforce to the fathers that, here's what the community wants of you. And so they started to feel like, oh, okay, I can do this because there is space in this community for me to be different. Another thing was the celebration at the end. So Real Fathers is a 7-month intervention, not including the very important training processes for elders. So at the end, there's a celebration where men get to stand up and, celebrate their achievements, and their wives stand up and support them and declare also what achievements they've had in the family. And this is an opportunity for the community to celebrate them and to encourage them to continue to maintain these behaviors, which when we've done follow-up research, we've also seen that many of them are maintained over time. And then in thinking about the gender transformative piece, I'm going to touch on a few things, but gender transformative is really, I think, in part about changing what what roles are acceptable for people in different genders, and how do you start to do that without simply just telling people like men can do household work, men can do this, right? Like how do you really touch into people on the inside? And I think Real Fathers did this really through a lot of emotion-based messaging and getting people to look inwards and start to explore what it is that they wanted, and then to complementary have skills development and some homework where they would go home and try it out, and their mentors would visit them and encourage them and talk to them. And that created space for men to start saying, oh, I can do this. Oh, I can see my wife in different ways. So I think that was part of this creation of a space for men to be different. The other piece I think that's really important is the work that's done with the mentors up front. So the level of training and engagement so that the mentors themselves have a gender transformative experience and are into this way of approaching the project before they even start training. Because ourselves, whether we're people like myself, who's a researcher or managing a project or actually doing the mentoring, we can reinforce these same kinds of things. And so are we spending enough time really training and building those skills so that people can, when they apply them, we're consistent in how we're applying them and they know how to creatively adapt their messaging to the situation.
I keep muting myself. Shamsi or Akeem, do you want to talk a little bit about your experience with gender? Shamsi, you just give us your.
Yeah, sure. Yeah, I just wanted to add a little bit. I think Anjali has covered most of the things that I wanted to share. Simply saying, when we talk about gender transformative approach, because we always discuss, and these questions comes all the time, you know, and people asking what the difference, because most of the people, as we say, do gender work, gender programs, gender activities. But what then the difference between, you know, what we know as being gender programs or initiatives and the gender transformative one? So I usually used to say, when most of the project or activities that are working on gender are trying to touch on the symptoms, you know, why are we having this such country, a lot of, you know, a high rate of maternal death, you know, child death and all that. But then the project comes to respond to this specific kind of issue or problem that is there, but it doesn't touch on the root causes. Why men, why boys are not involved, you know, in the first place. So when we are talking about gender transformative approaches, that approach that tries to touch on the root causes. So it's kind of, you know, helping those men, boys, and women and girls as well, you know, to try to start examining and try to start questioning and, you know, challenging those negative or harmful gender norms. And when you're doing this approach through the gender transformative group education with men themselves or couples or boys or girls, so we're trying to bring them to come up with more positive or think of more positive values. Because again, this is another jargon, maybe we are now having a lot of jargons, but trying to improve, you know, more positive, you know, values and attitudes, which turn to improve access to health and right for all. So this is basically the way we do it. And this is what I can say being the difference between the general gender programs or projects as opposed to gender transformative approaches. So the other way we do this, because what I've been sharing is basically talking about individual people trying to transform or to shift norms at individual level. But again, at Promundo, the other approach I've been, or strategy we've been using, and that have proved to be really very successful, is to use I would say the system or the theory of change that comes, you know, transforming those norms at individual level, but also having activities at community level and family level. Anjali has been talking about, you know, campaigns, you know, those small campaigns at community level, because what I've seen during those programs is that we may change behaviors and norms at individual level, but you know, in our societies, again, talking about Africa, the society or the community or the family is really very powerful when it comes to those norms. So they are learned at individual level, but very much reinforced at community level and family level. So that's why we are using this theory of change, having, yes, those strong sessions, 3-month long sessions with the individuals, but also planning for, other activities at, community and family level. But also, we also mind very much about the structural level, talking about policies, structures. In the beginning, I've been talking about a conducive or supportive environment. So it's really very important that, at that level of policy, there is also a number of activities, basically advocacy, sensitization, so that the decision makers also are aware, and also they mind about, having laws, structures, environmental support, that's change that is happening at individual level. And this is how Promodo we've been trying to implement those programs in all those countries around the world. And so far we've been seeing that having this approach really has a lot of positive results. As opposed, of course, maybe I don't know whether we'll be having opportunity to share about the challenges, because about projects, they are limited in terms of time, limited in terms of funding. So the project may work at an individual level, but when it comes to community level, structural level, scaling up mostly, so there's no more funds and all that. So those are some of the challenges we are facing when it comes to implement those very good, very nice projects that are very successful. But unfortunately, most of the time, you don't have time and funding, to continue and scale up those positive outcomes.
Yes, this question of scale. This is one of our big challenges, is how do we take these wonderful things that we've learned at a community or a village level and take it up through a district? And I think we're still grappling with that. But I wanted to pose a question to Akeem. And Shamsi mentioned a couple of things, as well as Anjali, about these issues of root causes, that we, as you said, we often treat the symptoms and we don't go far enough to really try to get at those root causes. And I think what's been really useful in projects that I've seen is that we create space for people to challenge and think differently about these sort of pervasive social norms, or this is the way we've always done it, so this is the way I'm going to do it. So maybe Akeem, can you talk a little bit about how your project, the RMA project, has created these spaces for people to think differently about these sort of the way it's always been done in these communities in Niger around early marriage and this lack of communication between partners. I think that one of the things that's coming out for me in this conversation is the incredible importance of helping people learn how to communicate differently, just not just accept this is the way it's always done, but to question and communicate with their partners, with their families, with their communities. So Akeem, you can talk a little bit more about that, if you could.
Yeah, tout à fait. Alors, je pense que nous,
Yes, exactly. I think that what we have done is we really tried to go for these very important aspects of social norms, and we looked at how we can encourage changes and how we can increase reproductive rights for young people. So to talk about communication and being able to change these issues, we adopted a similar mentorship approach that Anjali brought up. So for us, our mentorship approach was more based on mentors or leaders who were in the same generation. So we had mentors or community leaders who were within the same age range of the married people, but who had more experience and who were better able to communicate within their couple. Because we noticed that when we used mentors or leaders who were a bit older to discuss communication issues or gender role issues, often these people acted in such a way to impose their point of view or to impose their own opinions. So this did not allow the person who was targeted by the intervention to express himself or to really move about freely and explore some of these changes. So within these safe spaces that we created, we encourage people to meet. The women, the wives will meet together, the husbands will meet each other, and we encourage them to exchange experiences, and we want them to have open and free conversations about some of these issues. Each participant is encouraged to share his or her experience and to give some advice to his or her peers. And this meant that each individual was able to open up to the group and share some of their questions and experiences. And we noticed that the husbands became aware of the different issues that could exist in couples because they were within a group of husbands and they could all talk about their different issues. And the wives had the same experience. And this was a way for them to talk amongst themselves, and they were able to learn lessons from other members of the group. Another important aspect to encourage this conversation is the involvement of religious leaders in a positive way. We reached a stage where religious leaders are able to support a man and his wife. And when we're talking about empowering women, when we're talking about going with women and helping them to find access to these reproductive services, this has been a really positive change. And we have managed to get religious leaders to support men helping women in these decisions. And this has been a very positive outcome. And we know that this is really an important move, that a husband feels empowered to go with his wife or to help his wife have access to these services. We also have men who, when their wife is sick, the husband realizes that he is able to do housework, he can cook, he can clean, and he's able to support his wife when she is sick. And I would say that before, men tended to limit themselves only to what were considered male tasks or masculine tasks. So we have adopted a similar approach to what Anjali was explaining earlier. We have been focusing on mentors and leaders who are able to share their experience and openly discuss these issues with the targeted audience.
Thanks. Now we're starting to get some questions from the audience, which is great. I wanted to bring up this topic of age disparity. And I think now the Real Fathers Project, if I remember correctly, the couples were rather close in age. And I would think that and I know in other parts of Africa, in other countries as well, that oftentimes there's a big age gap between the young woman and her partner, which I would think would be challenging to support better communication between a 25-year-old man and a 16-year-old girl. There really isn't a whole lot in common right there, different life experiences. And so what are some of the ways that you've been able to facilitate or build better communication? And like you were talking also, Akeem, about when young couples, sometimes they're just married, they've never met each other, and all of a sudden they're thrown together in a house. And so, how do you navigate some of these real challenges around building better communication when there's sometimes so much difference between the partners themselves, the young couples? I don't know if somebody wants to start with that. Anjali? You look so full.
No, it's a really good question, and I'm not sure Real Fathers is the best position to answer it. I think Real really looked at a life stage opportunity, so trying to engage men as they were becoming new parents, recognizing that it could be an opportunity when behaviors are not ingrained and men are transitioning to, men and women really are transitioning to new attitudes and norms. So these norms of like, how should a parent behave? How are couples meant to communicate? That they're having to engage with it, whereas previously they might have been aware of it as a norm, consciously or not, but they're actually having to enact it. So really try to leverage that time as an opportunity. I think some of our couples are closer in age and some are further in age, but it really focused on like, okay, so once you are of this age and your commonality is becoming a father, can we start to open up space for these conversations? But we didn't directly engage with an age gap. We just used that transitional life stage as an opportunity to bring up these conversations. I don't know if the other projects were more intentional about age disparity.
I mean, I'm guessing, Akeem, that a lot of the couples that you're working with in Niger, there is this gap between the girls and the men that they're marrying, that there's a significant age gap. So how have you managed to navigate that real difference in life experience and the ability to facilitate good communications between two people who really have very different life experiences and capacities?
Yeah. Alors, c'est vrai que nous, dans notre contexte,
It is true that in our context, we have worked with these different kinds of couples. We also work with couples that the husband and wife are of about the same age, but I think that we have very simple goals to achieve. These adolescents and their husbands are people who need some kind of training. They need to learn to support each other. These women have not had the opportunity to learn how to express their needs and learn how to express themselves with their partner. We often work with young people who have not gone or have not received any health education. And so the only way to be able to reach out to these people and to raise their awareness, it is in small group meetings. And we organize these groups within the community. And we put these young parents with mentors and we tried to keep everyone within the same generation. So in these small group meetings, often these husbands are able to speak freely. And they're able to talk about their concerns, their questions, and they're able to talk about their roles as parents, and they're able to hear from mentors about the best responses. These young people, if they have questions, if they have concerns, will often wait for the next meeting. And then they are told that they can get their information from different health education programs and that they can learn more on their own as well. When we have husbands who are a bit older than their adolescent wives, these are often polygamous couples. An adolescent woman will find other wives in the household, and she will be the young wife. And often she doesn't have a lot of information. One thing that we have done, and it hasn't been easy, it's not easy for a woman to talk to other wives, to ask her questions about how things work within the couple and to ask these health related questions. But we have managed to get the other wives involved in having conversations with the husband. And also we have gotten them involved in being able to get these wives to bring the younger wife to the conversation. So we have tried to raise awareness among all partners so that they can continue to have these conversations with the husband as well. Another approach that we have used that has allowed us to change things is to get mothers-in-law involved. Particularly when we're talking about marriages with adolescents. Mothers-in-law often have a very significant influence on the husband, and they have a lot of influence on the whole household. So by getting this mother-in-law involved, and as we know, she is someone who is able to put pressure on the husband, then with her involvement, we have been able to get the mother-in-law to put some pressure on the husband to talk with his wife. So we have been able to work with the mothers-in-law and therefore change their opinions. And this has in fact affected the entire household. So a wife so we're able to have these conversations to talk to a woman about choosing when to have a child so she doesn't feel like she's in competition with the other wives of who can have the most children or who can produce the most for their husband. So this is often an issue in polygamous households where women will have competitions between themselves. But we try to have this conversation to let the woman know that her health and her children's health is the most important question, not the number of children.
Great.
So we have been trying to have these conversations and trying to change some of these social norms and these gender norms. And so in this way, we have broken this generational barrier between husbands who are a bit older and the wives who are a bit younger. But we know that what is most important is that to get the husband's mentality to change with regard to his wives and their health, and to empower women to work on their own sexual and reproductive health. So that is one way that we have addressed this issue. And beyond using religious leaders, we also used other processes to raise awareness. We used community radio stations, which are pretty widespread in most of our intervention zones. We also created sketches, and we put them on the radio. They shared different messages. They shared information and education. And we often had a specific target for each of these sketches. We might be targeting husbands. We might be targeting wives. We might be targeting young people. And when we're talking about age differences within couples, we think that we have had a bit of success with these sketches in changing husbands' mindset. So I hope that that has answered your question.
That's great. Thanks, Akeem. And I think what I found interesting there was, we talk about working with husbands, but the root cause there is actually the mother-in-law and the co-wives. And so even though we look at the dyad of the young woman and her partner, there are other people at play in that family that are influencing the decisions of both. So we are at time, and I hope you all will stay with us for a couple more minutes. There's a couple more questions that I just wanted to pose to our panel, and then we'll wrap up. So if you want to hang out with us for another 10 minutes or so. The first question I wanted to pose very quickly to Anjali was, we had a question from one of the participants about how do you work in a real father's type situation if the father is not living in the household with the mother. So if you want to answer that, and then the last question we will wrap up with is this question of scale. And I think we have some more information about, I think, scaling up normative changes. I think AYRH has done a lot of work in this area, but I would like to hear a little bit more about how AYRH has tackled this, how Promundo, and I also think Akeem, the Pathfinder Niger, is doing some scale up of this approach. And so what have been some of the lessons learned from scale up, challenges, opportunities, positives, et cetera. And then we'll try to wrap up by 8:15 US time. So Anjali, to you for about the young fathers that don't live in the household with their
Yeah, well, that's a really interesting question. I'm not sure that we actually did work with young fathers that were not living in a household. They didn't have to be married, but we wanted them in partnership. What this might be related, but we also, and I heard Akeem talking about this, was that, working with men who are in polygamous relationships. And that's where I think we were challenged a bit. And I don't think we, in the initial pilot, we really addressed it well enough, was because we were working with one young father, and then there would be a few complementary sessions with one of his wives. But there is this tension then in the household that why that wife, why not this wife, or, what does it mean to work with a young father and one wife, and are they being privileged, right? And so there was some resistance in the household sometimes, where other wives were saying like, I don't like the changes he's making, because in part because she hadn't been brought on board. So she viewed it as threatening, right? And some other wives thought it was great, but it was this piece where I think we didn't address enough. What does it mean to think about polygamous family in this situation? And should we have been working with multiple wives? But in terms of the question where they're not necessarily living together, I think it's a bit different. I can also respond to the scale, or have other people respond and add to it.
Yeah, go ahead.
So yeah, you're right. AYRH has done a lot of work on scale, and we've approached it in different ways, but really trying to think more systematically from the beginning of a program. What can we start to unpack? What are the key activities, the key elements of a project, the key values of a project, and the key mechanisms of change? Because the better we can understand how our projects are working in context when they're working, the better we can do adaptation into new contexts, right? And so, I think previously a lot of work focused on adaptation was around like maintaining the same project and then, translating. And here we're trying to say, like, can we start to understand in a new context, what are the values? Or, real fathers, we took it from one setting where mentors were very high literate, and we moved it to another setting where they were not. And so we really had to adjust our supervision and our training to meet the needs of those mentors. And that reframed a lot of our tools, right? And that was an adaptation that continued to maintain the values and at the same time bring in the values of that local community. So that was a piece of scale that I think is really important. Another part, I think, is how do you then start to work with local structures to have buy-in, and so that the vision is beyond this project. And we've, depending on the setting, we've been more successful or less successful. Sometimes there's a lot of buy-in, and then coming back to what my other colleagues have said is like, is there enough funding to carry it through? Which is, people might really like it, but then how do you carry it forward? And then another piece I think is really thinking about context, and this is not from Real Fathers, but one of the other projects we work on, we took it from a very rural setting and moved it into a very urban setting. And I think what we didn't address enough in the beginning was, how do those dynamics, those social dynamics, those normative influences of behavior, who you need to engage and how you need to engage them, change when you go from a very rural setting to a very urban setting where people are moving about and engaging with each other differently? And what does the role of the social mean in that setting? So I think really starting to unpack those pieces that are critical to what makes a program work are really helpful as we start to think about scale.
So we only have about 6 more minutes. We do have a hard stop at 8:15 US time. So Shamsi, if you can take a couple of minutes maybe to talk about your observations of Promundo's work around scale, and then we can let Akeem have a couple of minutes as well, and then we will close.
Yeah, sure. I can quickly share our experience from Rwanda, because I think this is the one we can easily share. What we implemented the Men Care Plus program for 3 years between 2013 and 2015. And this was, again, engaging men as positive fathers in maternal health, SRH, and all that. So the program was for 3 years, and then we conducted a randomized controlled trial that was really very impressive. So, and then we started thinking about how to scale up this, very good experience or practice in Rwanda. So for Promundo, the approach we are taking is to work with the government, especially thinking about sustainability, because this is what we have learned throughout the implementation of the program, especially those kind of, big programs, expensive programs. So the only way to ensure sustainability is to make sure we have the buy-in of the government so that they can sustain, the program for long term. So what we've been doing, I mentioned the RCT, and this again, our experience with Rwanda is to make sure you generate evidence, because actually this is what the government want to see. just not going to them and saying this has worked and all that, but when you come with, evidence showing that the program works, the methodology or the model, the approach works, it makes it easy for the government, to buy in the approach and start discussing and also, doing this kind of advocacy to make sure that the government takes, put it in its own priorities. So I can say that for Rwanda, for this main care plus that you're trying to scale up, we already have the buy-in, but continuing to provide this technical assistance. So we are calling now we are transitioning to scale. So the program that was implemented in 4 districts, we are now trying to experience or to see how it can work in one of the districts, because the first phase was implemented through just, lay community facilitators. But this time we are trying to scale up through community health workers, through the Ministry of Health. Because, again, I think Anjali talked about contexts and structures and everything. Like, for instance, for Rwanda, we can say that as we are dealing with health issues, the ministry has, very well structures, very good structure with the community health workers that are based up to the very low level of the community. So we think that that will be the best structure to go through if you want to sustain or to bring to scale such a very, successful program. So this is why we are approaching the scale-up approach at Promundo. I mean, for instance, for the
Great. Yeah, the government has to be an important partner. Okay, so Akim, you have 2 minutes to talk about how you've been able to do some work around scaling in different districts.
Okay, merci bien.
Thank you so much. Well, I believe that in the context of the implementation of these major interventions, the government, the health ministry were key stakeholders, and they played a major role, which then allowed not only to promote ownership and buy-in on the interventions, but also to define together a model in the framework of current research that we are doing. And we are trying to define a model that we've called an RMA model, which will be scaled up to the entire country and will also be implemented in most of the health districts of the country. That model that we have proposed has been presented to the approval of the government authorities, and it was validated with them. The model wanted to be as simple as possible and as easy to support as possible with the lowest possible costs so that it could be supported within the context of action plans of the various health districts.
That's a really important point, Akim.
That's how we were able to do this, to make this approach sustainable.
That's a great point to end on, that we need to be able to present governments with simple, low cost things that they can take to scale. Again, we have a hard stop. I'm really sorry to rush us through, but thank you so much for joining us today. And just to let you know, we'll do one more session in this module on December 16th at 7 a.m. Eastern Standard Time on phones. Looking more broadly, not just at phones, but at social media and its influence on young people. So again, thanks for joining us this morning. Thanks to our panelists. Really, really insightful comments. Sorry we couldn't get to every question, but do join us again in 2 weeks for the last session in this module. So
thank you,
everybody.
Thank you.
Thank you.
Merci beaucoup.
Have a good rest of your day. Merci beaucoup.
Bravo.
Okay.
Bonne journée à vous.
Bonne journée. Merci. Thank you.